Hello, and welcome to another episode of Therapy on Tap. I'm your host, Charles Perry. This is my third episode. So, for today's episode, we're going to cover panic attacks. Panic attacks, I would not wish them on my worst enemy. It is one of the worst conditions you can have. Now, there are individual panic attacks. There's also what's called panic disorder. We'll get into the difference there. Okay, the main difference there is just that the panic disorder means that it happens frequently. Right? We can all have one-off panic attacks, but if it's something that's happening frequently, then it becomes a disorder. Okay, but first we need to figure out, well, what is a panic attack? There's obviously an overlap between anxiety and a panic attack, right? And we think of anxiety as tension. We think of anxiety as unease. We think of anxiety as maybe worry. Our heart is racing a little bit. We have a pit in our stomach. We're sweating. Panic attack is all of that just souped up and hypercharged. It's 100 times worse. Okay, so a panic attack is a very short, sudden burst of very, very intense anxiety. Okay, and there's a number of symptoms that people can experience, and everyone experiences slightly different symptoms, obviously. Let's take a look at some of these symptoms. One of the biggest symptoms that most people experience, and this is kind of a hard feeling to really describe, but this is often what people will describe, is a feeling of doom. A feeling of doom, which is a feeling of dread. It's a feeling that the world is coming to the end, that maybe their life is coming to the end. That is very common for people. They're afraid that they're going to die. They're afraid they're going to have a heart attack. Okay, so that's what brings on such intense fear, is that they feel like everything's over. They're dying. I mean, you can't think of anything scarier than that, right? So that is why the panic attack is so scary. So the other physical symptoms are rapid heart rate, obviously. There's sweating, there's shaking, there's shortness of breath, there's stomach discomfort, there's chest tightness, there's dizziness. Some people will get really lightheaded. There's also numbness and tingling, and some people will even feel a feeling of detachment. It's almost like they're outside of themselves and they're like watching their body. Okay, so it is a very intense, localized version of anxiety cranked up to 1,000. Okay, and the main feeling that usually lingers for most people is either a feeling of death, doom, or feeling like they're going to have a heart attack. Or for some people, it's feeling that they can't breathe, they can't get oxygen in. So it's a terrifying feeling. I would not wish it, as I said, on my worst enemy. If you have this, I'm sure you know just how bad this can be. So what can we do about it? Well, first we have to ask, what causes a panic attack? Well, panic attacks can be caused by a few things. One are phobias. So a phobia is just a fear of something, right? One very common phobia for panic attacks is what's called agoraphobia, which is a fear of open spaces or a fear of being outside. There's actually a specific diagnosis for panic attack disorder with agoraphobia, and that's for people who have agoraphobia. They have a fear of going outside, and that fear causes them to have panic attacks, and that can be absolutely life-altering and devastating. Okay, it can also be a fear of really anything. I mean, it could be a fear of claustrophobia, which is the fear of tight spaces. It could be a fear of, I don't know, spiders. It could be a fear of dogs. And you could see, depending on what your fear is, might dictate how frequently or infrequently you have it. So if you have a fear of, I don't know, jellyfish, but you live on land and you live in the mainland, well, you're probably not going to have a panic attack too often. Okay, but if you have agoraphobia and you have a fear of going outside, then you're going to feel this quite often. Okay, so the one cause can be a fear. A second cause can be, now depending on the definition, this can and cannot count, but I'm going to throw this in there. The second cause can be a real life event. So a real life event is like you're actually in danger, right? Now, some people will just call that fear, and that's true. It is just fear, but you can have that same kind of response. Okay, and the response is it is an adrenaline boost. Your adrenaline is getting shot up, and that is why you're getting such intense feelings. It is your fight or flight response. When you're in a real life scenario and you're in a fight or flight response, your body responds by either fighting, running away, or freezing. But if it's not in a real life scenario, there's really nothing to do. If we're just sitting around on the couch one day and we have a panic attack, we're not in a real life scenario, but we're having a panic attack. So, but you can have the same symptoms in a real life scenario. That obviously is a very different situation. That is actual danger. And obviously you need to do whatever you need to do to survive. So I'm going to throw that in there. It doesn't really count as part of the panic attack diagnosis because really to have this panic attack diagnosis, it has to be something that isn't a threat. right? Because if it's a threat, it's not a problem. It's not a psychological problem. It's you just need to survive. Another cause of this can obviously be trauma, so some kind of traumatic experience, but this can also be part of, let's say, a PTSD diagnosis, but this can also be a response to trauma. Obviously, it could also be that your phobia has been caused by some sort of trauma. So that's another cause. And the last cause is really unknown. The last cause is it can happen anywhere at any time for any reason, and it's really unknown. Now, if you ask a psychoanalyst, they'll say that there's some underlying unconscious motivation or reason for why that is. It doesn't just come out of nowhere. And that makes sense, right? It's hard to imagine that something could just come out of nowhere. But the problem with trying to uncover unconscious motivations is it's pretty hard to do that, right? By definition, it is unconscious. So if it's unconscious, it's not available to the person who's experiencing it because obviously by definition, it's out of their realm of consciousness. They're not aware of it. So if they can't be aware of it, you can think how much harder it is for someone else to try to understand what that is. There are some people who think that that can be done. I'm not super sold on that, but that's regardless. I'm more of a here and now therapist, but some people like to explore that. And I don't want to say that we all have unconscious motivations. We all have things that are bubbling up underneath the surface. The only problem is it's not always clear how to directly tie that in with something that is happening now. Sometimes we can do it logically. It feels like there's a connection, but there's no real way to empirically prove a lot of that stuff. So that stuff I like to throw up as the unknown. Okay, so those are the causes of panic attacks. Those are the main causes. Okay, and again, so a panic attack is really just a release of adrenaline. It is basically you're having a fight or flight response when you're not supposed to have a fight or flight response. You're not in any danger, and yet your body is still sending you all this adrenaline, and you don't know what to do with it. And that's why if you're actually in a dangerous response, you probably wouldn't even be as aware of it, because you'd be so focused on survival that the physiological response you're not as obsessed with. And this is one of the problems that happens with people with panic attacks is they get very obsessed about the physical sensations. Okay, I'm not saying that a real life situation is any better. Obviously, it's worse. I'm just saying that is why with panic attacks, one of the reasons why people get panic attack disorder, which is repeated panic attacks, is they tend to get very focused on the physical response. And what that causes is a fear of another panic attack coming. And this is the problem with panic attacks is once you have one, if that sensation was very uncomfortable for you, you can now develop a fear of the sensation. And then what happens is people will go around and they're checking their body constantly to make sure they don't have another one. And that's what can develop into what we call panic attack disorder, which is just multiple panic attacks and a constant fear that another one is coming. Okay, so how do we treat panic attacks? I'm not going to go into the medical treatments. I'm not a psychiatrist. I'm not a doctor. I'm a therapist. So I'm not going to talk about medication today. That is an option, but I'm not going to talk about medication in this podcast. So I'd like to break the treatments down into two potential options. There is the Band-Aid, what I would call the Band-Aid treatment, which is the quick fix. This is not to say that it's the wrong way to do it. This is more for when you're actually in the moment and you have to just deal with. Okay, there's the Band-Aid solution, and then there's the long-term solution. So the Band-Aid solution is just how do we get through it? How do we get through the panic attack? The best way, I think, to get through a panic attack in the moment is through a breathing technique. And this breathing technique is a very specific breathing technique because a lot of people, when they try to do a breathing exercise when they're having a panic attack, sometimes it can exacerbate it. It can make it worse. And the reason for that is because typically when you have a panic attack, one of the symptoms, as I mentioned before, is a very tight chest, very intense tightness in the chest. So when people try to do breathing, they panic more because they notice they feel like they can't get breath, they can't get oxygen down, and then they panic that they're not breathing well enough. So instead, what we're going to do is we're going to focus on the stomach. This is called diaphragmatic breathing. Okay, and what you can do here is you take your hand, you place it on your stomach. You could practice this before you have a panic attack, so you learn how to do this. You inhale through your nose, and you try to fill up your stomach with as much air as you possibly can and try to follow the air. Don't expand the chest. We're going to stay away from the chest because the chest when you're having a panic attack is tight. We're going to expand the stomach as you breathe in, follow the air down to the stomach. You should be able to push your hand out with your stomach, breathe in, hold it, and then blow out. And you should be able to feel your stomach retracting to its normal position. And do that repeatedly until you start to calm down. So we're going to stay away from the chest. The reason why we still stay away from the chest is because that is one of the major symptoms of the panic attack is tightness in the chest, heart racing, feeling like you can't breathe. So if you focus on the chest, you're going to start obsessing about the chest. And then a lot of times that's why the breathing exercises don't work for people. So in this one, you have to focus on the stomach. That is what I found is one of the better treatments in the moment for the panic attack. Other kind of quick fixes doesn't always work. Pacing can be very helpful because you have to think that, again, you're having an adrenaline shock. So you have all this adrenaline coursing through your system. You have to get it out. Okay. So you have to move your body. If you sit, your body's just going to be pumped with this adrenaline and it doesn't know what to do with it. So pacing can be very helpful. Walking around, moving your body, getting out if you can. That's something that can be helpful. Okay. But again, those are Band-Aid responses. They're helpful in the moment, but they're not really a real fix to the problem. Okay. So then how do we treat the actual problem at hand? We don't want just quick fixes. We want to hit this head on. The first part is just educational. You have to realize that unless you have, and you have to clear this with your doctor, but unless you have a very severe medical issue or you have a very severe, especially heart condition, the panic attack is not dangerous to you. Can't actually hurt you. Now, again, clear this with your doctor. Make sure you don't have any underlying heart conditions. But if you don't have a heart condition, there really is no danger to the panic attack itself. It just feels extremely dangerous. So that's the first thing you have to realize. As much as you feel like you're in danger, you're actually not in any danger. And that's the biggest problem, right? Because that is what sends people into the panic in the first place, is that feeling of doom, that feeling of threat, that feeling of death, that feeling of danger. So you have to remind yourself, when that panic attack comes, first thing you tell yourself is, this is going to be really uncomfortable. This is going to suck, but this will pass. I'm not in actual danger. I'm not in actual threat. I'm not going to die. As much as I feel like I'm going to die, as much as I feel like I'm going to have a heart attack, as much as I feel this sense of doom, I'm not actually in danger. Sometimes that alone can fix the problem. Once you realize that, now you just have to deal with the symptoms. That's the first thing. It's just the education. You have to realize it's not actually a threat to you. It just feels really uncomfortable. The second part that we need to focus on, if that doesn't clear it away, which often it won't, that often isn't enough. The other element to this is what we call exposure therapy. Exposure therapy is essentially gradually exposing yourself to things that you're fearful of over time, so your body can adjust to the fearful stimulus and therefore is no longer frightened by the stimulus. Now, there's two elements in the panic attack. The first element is the feared object, right? So if it's agoraphobia, it could be outdoor spaces. If it's spiders, it could be spiders, right? So that's the outside object that you're afraid of. The other element of the panic attack fear is the panic attack itself. And this is what causes the panic attack disorder, is that people get afraid that they're going to have another one and they become fearful of the sensations. So what we need to do is get comfortable with the sensations. We need to get comfortable with the discomfort. So what you can do is practice this in the safety of your own home when you're not having a panic attack. You sit down with yourself and you can imagine a panic attack. Imagine whatever that trigger might be. You might know what the trigger is. It could be maybe a car, getting in a car. It could be just going out for a walk. Some people could be giving a speech, whatever it is. Picture it. It should get your anxiety up a little bit, but not completely. Feel that anxiety come to you. Notice the sensations and sit with them. Don't let them run away yet. Don't push them away. Be with them. Be curious. Check in with your heart rate. Check in with the tingling in your legs and your feet. Check in with the tingling sensation in the back of your neck. Check in with the uncomfortable sensation in your stomach, the lump in your throat, all those sensations. Notice them. Don't judge them, okay? And again, remind yourself, this is not dangerous. This is just uncomfortable. This will pass. But what happens is, as you do this over and over again, you get comfortable with the uncomfortable feelings. So that way, the next time it happens, when it happens in real time, when the panic attack comes, well, you've already felt this before. You know this feeling. It's uncomfortable, but you know it passes, and you know you can allow it to pass if you let it. So once you start getting comfortable with these uncomfortable feelings, letting them pass, you start to essentially get braver. You don't see the symptoms as a threat anymore. And again, this is what causes the doom and the fear of death. We perceive the symptoms themselves as dangerous. Because again, a lot of times a panic attack doesn't even have a trigger. A lot of times the panic attack is random. So there is no actual threat. The only threat is the feeling itself. So once we get comfortable with the feeling, you have to do this regularly, do this every day. Okay. And it's not fun. It's hard to motivate yourself to do this because who wants to do this? That ultimately will lead you to a path of recovery for panic attacks. Now, again, if your panic attack is caused by an actual phobia, let's say getting in cars, let's say driving over a bridge, for example, is a good example, or getting into a train, right? Riding on the train. If that's the case, you also have to do the exposure therapy for those things. Okay, so you want to see a therapist who focuses in exposure therapy. Part of the therapy might be, let's say you're afraid of getting on buses and trains. Part of the therapy might be going with the therapist or going with a friend on a bus. And you do this gradually, right? You do this over time. You don't jump into things you're afraid of. It might even start out as imagination exposure, which is just thinking about getting on a train, thinking about getting on a bus. And again, but it's the same thing. You're going to sit, you're going to imagine these scenarios, imagine those feelings, let the anxiety come and let the anxiety pass. You're not going to try to fight it. You're not going to try to avoid it. And that is the other big key to remember with anxiety in general, but especially panic attacks and phobias. We essentially want to avoid avoiding, right? Our body wants to avoid these things because they're making us uncomfortable and it feels like they're putting us in danger. But that's a trick of the anxiety. It has convinced us that we're in danger, so we want to avoid. So we need to avoid avoiding. So all the things you don't want to do, those are the things you have to do. Now, obviously, that's easier said than done. You take it slow with the therapist. You don't rush it. But that is the best way we know how to treat panic attacks right now. Obviously, there's also medication options you can talk to a psychiatrist about. Okay, but again, I'm not a psychiatrist. I'm not going to go into that today. But those are the main things to remember about panic attacks. They're not actually dangerous unless you have a severe heart condition or something like that. You have to talk to your doctor. But for most people, they're not dangerous. And you have to remember, number two, that the symptoms themselves are not a threat. They are not danger. They feel like danger, but they're not danger. And the moment you start to really internalize that and realize that they are just passing feelings, makes it a lot easier to get through the panic because now it doesn't feel like it's never going to end, or now it doesn't feel like it's going to end with death. It just feels like it's going to end in time, maybe 5 minutes, maybe 10 minutes, maybe 20. It might be 30 seconds, but it feels like an hour, right? But it will pass in time. And then on top of that is doing the exposure therapy with a therapist who knows how to do exposure therapy. So that's how we get through panic attacks. If you're having a panic attack, please seek help. There's no shame in it. It is a terrifying experience. Would not wish it on my worst enemy. If you're struggling with this, I hope you get the help you need. Thanks again for tuning in, and I'll see you soon.